Audio Jungle.
What's going on, COVID warriors? This is out of Florida here. This is just the Florida Department of Health confirming the other video and what we've seen from the CDC in terms of guidelines for the exaggeration of the deaths of COVID-19. And that's because of the expansion of the scope of the definition and how to classify these deaths. So that was done at the CDC level, and that has been recommended out. This has, of course, been denied by that fraud Fauci, who needs to be fired. The guy is worthless. He's incompetent. He's dangerous. And he's pushing a conspiracy theory that there is no exaggeration possible on the COVID-19 death reports. The CDC admitted so, and that, again, is just another corroboration of what we have here from the Florida Department of Health. So, from the Sun Sentinel, it says the Florida Department of Health declined to answer questions about its methodology or process for recording coronavirus deaths, other than to issue a statement saying the department's list includes every person known to have died and tested positive, which is in complete accord with the CDC's recommendation. So they're really not doing anything different, but they are corroborating also what Dr. Birx said, because this is the reality. And this is what their statement said out of the Florida Department. Quote, when the state reports COVID-19 related deaths, this does not necessarily mean COVID-19 was the cause of death. When the state reports a death, it means the individual tested positive for COVID-19, end quote. So, clearly telling you, as long as you've got it, we're listing you as someone who has died from it instead of just with it. And one thing of note here is Dr. Sneed, medical examiner of Palm Beach County, said that she's concerned about missing some coronavirus fatalities, entirely largely those involving people with underlying medical conditions who die at home. We've already seen, depending on whether it be from Italy, 98% or over 90% here, that there are underlying medical conditions for those people who are being reported of dying from, or we'll also add now with COVID-19. I mean, seriously, how big of a threat to the data numbers this is? People who could, I mean, is this possible? Sure, it's possible. It's not like people are going to die at home because they can't get in a hospital anywhere in the country. It's not happening. Film your hospital. We've seen the evidence. We have Governor Nipplering Cuomo said he needed all these beds. 4,000 beds in Jacob Javits Center, literally empty. Same thing for the USS Comfort, empty. None of them were used. They were all none of them were used for their original purpose, which was all the hospitals were going to be overflowing with COVID-19. It's going to be the Black Death all over again, with this BS being pushed by this pro-COVID liberal media. We're just dying for these things to be as bad as they say they are. Okay, so I went over this in the other video, and I just think it's so important to bring it back again. This is from the NVSS and the new ICD codes for COVID-19. What has been provided is actually two split codes. There is a U07.1, which is for COVID-19 death, and there's a U07.2, where there's COVID-19 where a laboratory confirmation is inconclusive or not available. It continues, because laboratory test results are not typically reported on death certificates in the U.S., NCHS is not planning to implement the U07.2 for mortality statistics. So This makes absolutely no sense when you are looking for mortality statistics. As someone who deals with data analytics, you're always wanting more data, more granular data whenever you can get it, so that you can slice and dice it and come up with more information. If you have enough data, your data will eventually tell the story to you. If it's not, doesn't have enough it only goes so far. I mean, this is just common sense. Why are they not using this U07.2 code? This could be used in other cases. And why is someone like that medical examiner out of Palm Beach County so concerned about someone dying in their home? Why? And she was talking about statistics, mortality statistics. Why is she not concerned about the lack of use of this second flag factor for those records? This just doesn't make any sense. It's very clear that there is a motive to overinflate, and there isn't even a motive to want to get some of the more detailed data that you would really need, that would be really important for helping to make the best decisions. We already know that the president was pushed and forced based off of numbers of 2.5 million deaths, which were expected. Those were the original projections, and it was based off of that he implemented the no travel, and everything cascaded down from there. That was why we're on lockdown, and financially, lives and families and businesses are being completely gutted and ruined. And the media having a field day being pro-COVID on this. And it just doesn't make sense to continuing with the same method or cure for a disease that's not the same disease that you were told it was. It doesn't make any sense. We need to end this lockdown, and other frauds like Fauci need to be fired, and people need to be able to keep asking these questions here. There's no doubt people are dying over this. I understand this. They're still learning about this, but it makes no sense to cook the books and to BS our ways around this, and that somehow you can't do an analysis over this, or that they can't keep track of this data, which I've seen in a different article out of Michigan. Somehow, it's just too complicated. It's only too complicated because it wasn't going to give them the answers that they want. Bro, all I gotta say, man, when this is all over, this corona thing, I want to party with you, bro.